Good morning, good afternoon, or good evening, everyone, to wherever you may be joining us in the world from. My name is Janelle Bab, and I am Regional Advisor on Education for Health and Wellbeing in the UNESCO Bangkok office. UNESCO being one of the co-sponsors of the joint UN program on AIDS, UNAIDS, who is delighted to welcome all of you here to this regional launch event of the 2021 UNAIDS World AIDS Day report. Now, in the lead up to AIDS Day, which is commemorated across the globe on 1st December every year, tomorrow, the Joint UN Program on AIDS, UNAIDS, is launching this report entitled Unequal, Unprepared, Under Threat: Why Bold Action Against Inequalities is Needed to End AIDS, Stop COVID-19, and Prepare for Future Pandemics. The global launch event took place yesterday, 29th November, from Haiti, and today we're doing it together for the Asia Pacific region. This report adheres to the theme for 2021's World AIDS Day, which is End Equalities, End Inequalities, End AIDS, End Pandemics, and calls for greater attention to critical elements for both ending AIDS and for pandemic preparedness and responses. This report emphasizes that addressing inequalities is therefore a critical ingredient to ending AIDS and COVID-19 and preventing future pandemics. So, in this short but rich 1 hour launch event, we do have some compelling presentations. We'll start with an overview of the key messages and findings of the World AIDS Day report as presented by colleagues from UNAIDS. And then we'll go into a panel segment with three esteemed speakers presenting on country context or context of different stakeholder groups who are so critical to achieving our goal of ending AIDS. So without further ado, please allow me to introduce our first presenter. And he is the UNAIDS Regional Director for Asia and the Pacific, Mr. Tawfiq Bakali, who will present for us the key findings and messages from the year's report. Tawfiq, over to you, please.
Thank you so much, Janelle, for this excellent introduction. Really good opportunity to gather with colleagues joining us from around the world around this launch of the global report in its regional context. And I also welcome the panelists who have joined us today for the discussions to give concrete realities from Asia and the Pacific with regard to the themes of this report, which is, as you mentioned, about ending inequalities. I'm waiting for the slides to load, if possible. This report is, mastering the technology, the challenge of all the time. Really good. Thank you for the opportunity, for helping us with this. This is the regional launch of the World AIDS report, which is titled Unequal, Unprepared, Under Threat: Why Bold Action Against Inequalities is Needed to End AIDS, Stop COVID-19, and Prepare for Future Pandemics. As you all know, inequalities is a core theme at the center of the development of the global AIDS strategy and strongly reflected within the political declaration adopted in July 2021. Ending inequalities is really important. The evidence tells us so many ways why the achievements on the HIV response have slowed down in recent years, even before COVID. This is not a report about data, but it does have a reference to the striking evidence that we need to keep in mind when we talk about the scale of the epidemic affecting 37.7 million people living with HIV globally. 5.8 million of them are living in Asia Pacific, with over 1.5 million new infections and 680,000 deaths, AIDS-related deaths globally. And you see the numbers also for Asia Pacific. There are goals that have been set for 2030 and also for 2025, and there is need to scale up our efforts to achieve those targets. And the question is not only about scale up, it's addressing the root causes why our performance with regard to achieving those goals have not been going in the pace that would lead us to the results by 2030. And as you can see in this slide here, it tells us that the pace of reduction of new HIV infection has slowed down. If it continues in the same way, we will not get there by 2030, both globally, but also for Asia and the Pacific, where we know we are already a little bit behind in terms of rate of decline at 21% compared to the 31% global rates of decline of HIV new infections. But interesting to note that in the early part of the decade, years 2000 to 2010, the rate of the decline was much higher because a lot of innovations and targeted interventions for key populations that respond to the specificity of the epidemic in the region were established and scaled up at that time. And we had a very good rates of decline of HIV infections during the first part of the decade. Unfortunately, this has slowed down too much, where we do not see much improvement, and that requires a complete shift in how we strengthen and maintain the global AIDS response. This is particularly in consideration of the fact that in Asia and the Pacific, the epidemic is mostly affecting key populations and their partners. At 94% of all infections are among sex workers, people who inject drugs, men who have sex with men, transgender people, and their clients and the partners. So there is need to consider the specific needs for these populations and the inequalities they might be facing that prevent them from accessing the HIV prevention and testing services. And as you can see, 40 years into the epidemic and several years after the great achievements that were initiated around the year 2000 or right before or during the first decade, which had led us to good results at that time, we are still a little bit far away from achieving the prevention targets here. And as you can see from this slide, without going to the details, the cloud of the points which reflects the prevention coverage by each key population are way too low, way below the 50%. And that reflects the challenges that we are facing, or that key populations are facing in accessing the prevention services for several reasons, including laws and policies, including program design, including economic inequalities, including social, cultural stigma and discrimination, and all these aspects. And it's not only an issue of talking about scale up of program and doing more, but it's also considering the how we do it and what's the environment where this work is happening, so that we can see that this cloud, which is at around the 20 and 30%, can move towards the targets of the 95% as reflected in the global AIDS strategy. It's with this regard, I mean, when we consider that similar situation is seen around HIV testing, with around 50% overall coverage for key populations, we do realize why we are a little bit behind in achieving the treatment targets, despite the fact that it looks or it appears easier to invest on treatment than invest in prevention, particularly for key populations. As we see the domestic investments are going. But still, with challenges for key populations and the inequalities they are facing in accessing prevention and testing services, we cannot treat our way out of the epidemic, and we cannot depend on treatment to achieve the global goal, including for reducing AIDS-related deaths and infections. With 61% viral load suppression as an estimate overall, we are still far behind on having the impact of the treatment on the epidemic. But then we had the pandemic. COVID-19 had come in 2019, and we have seen a lot of disruptions on all facets of life, not only affecting HIV services, but all kinds of services. And this has caused, and we have the evidence that showed us how the evidence around program access, around treatment scale-up, treatment coverage improvement has slowed down, particularly in the first part of 2020. Lots of gains became at risk. Lots of key populations could not access services. But at the same time, we have seen the remarkable successes being done and achieved to ensure the continuation of HIV-related service delivery for the populations who are mostly affected and those who are left behind. The pandemic has also highlighted the inequalities. It's brought light on the existing issues that were putting people far behind and limiting their access to services. But at the same time, we have seen the importance of innovations, the importance of community organizations scaling up, stepping up to provide services, not only to access HIV services, but to access social protection, to access COVID prevention and even COVID vaccine services, and link up those populations which otherwise would have been even further marginalized and even left out from any national efforts, including for social protection. Because of the HIV infection and AIDS-related deaths are not being fast enough already from before the COVID. But then COVID came in and slowed down whatever progress that was being achieved. Now, if things remained already at the same level known in terms of level of effort for prevention, testing, and treatment, the modeling determines that we could face 7.7 million AIDS-related deaths during this decade, between now and 2030. So it remains really important to step up the efforts, to scale up, and also make sure that the gains that were achieved are not lost due to any new wave of COVID or any other pandemic. So it's really important to strengthen resilience and to build the systems that would help us save the gains and continue towards achieving the global targets. Now, this is a slide for Asia and the Pacific countries where we managed to have the data. And if we compare for each country, that's the net treatment scale up as a percentage between 2019 and 2020. You can see that the red in almost every country, the red bar are lower than the blue bars. And that's a reflection probably directly linked to COVID, but that's a reflection that 2020 has seen a major slowdown in terms of continuing our progress here for treatment in this example. And that's not only, this situation is not only seen with regard to treatment, but we've seen it also with regard to access to prevention. So this is why it became really important to consider the critical elements that would help move us towards achieving the global AIDS strategy targets. And these are 5 critical elements which we will try to dig a little bit deeper and discuss and talk about during this presentation. Many actions need to end AIDS are also urgent and much needed to end COVID-19 and help prepare us for the future and any future epidemic, building the resilience and the capacities and the systems to overcome the possible challenges, but also sustain the gains. These critical elements are these 5 in the orange box you might see in your screen. Community-led and community-based infrastructure, equitable access to medicines, vaccines, and health technologies, supporting workers on the pandemic front lines, human rights at the center of pandemic responses, and people-centered data systems that highlight inequalities. Now, it was easy in this report to make strong links between all these components, not only from the HIV lens perspective, but the preparedness to pandemics. And that's why this strong link, as reflected in the title of this report, is strongly indicating that the investment on these critical elements is key for not only for the HIV response, but for responding to all kinds of pandemics, including the ongoing one with COVID-19. Okay. The first one, let's talk a little bit more about the first one, which is about community-led and community-based infrastructure. Civil society organizations, especially those led by people most affected, they have demonstrated that they have the capacity to complement traditional health systems for pandemic response. We have lots of evidence coming up from around the world where the community organizations and networks of people living with HIV have stepped up not only to ensure to deliver commodities to the people who otherwise cannot leave homes due to restrictions and lockdowns, ensure continuation of service delivery, ensure that people continue accessing or facilitate linkages for accessing to treatment and prevention and testing services, but also at the same time in facilitating access to social protection mechanisms, distributing food and basic livelihood support to populations and communities who have been seriously affected. And at the same time, also, we have many examples seen in the regions, in different countries where these communities have facilitated access to COVID-19 prevention as well as vaccination programs. The particularity of community organizations and why it's really important that they lead on the response and their structure needs to be strengthened is that they are more trusted and more likely to understand the needs and adapt to them, to ways to reach most in need communities. And that is key to help alleviate or remove the inequalities that are existing or that get in place due to lockdowns or restrictions that further prevents people from accessing services. And these are this slide is a number of examples that we have seen in the regions, in Asia and the Pacific, and there are many more. If I can go listing each one, and I'm sure I will be missing many more because there is just so much space in a slide. But we do have full evidence that told us with striking examples and solutions that have been designed and implemented by community organizations in facilitating implementation of innovative approaches, community solidarity, building resilience for HIV response, ensuring continuation of treatment for people who otherwise would not have access to this. And a great appreciation to all the efforts by communities, and the report itself highlight a number of examples that are featured also in the report to give us inspiration that these can be done and how important is the impact of these interventions or their involvement in responding to the issues of inequalities. The second component is equitable access to medicines, vaccines, and health technologies. And this is definitely, as you all appreciate, this is a subject of these days, particularly with regard to access to vaccines. And it can translate as well to the challenges faced around access to all kinds of medicines and commodities, particularly if we mention the unequal distribution, of COVID-19 vaccines, difficulty and affordability in accessing new HIV treatment formulations that might be further developed for adults and children, oral and pre-exposure prophylaxis, HIV vaccines and cure. And these are just an example concretely from the perspective of HIV, which also translates very well with what we see with regard to access to COVID vaccines and medication. So there are some pillars that have been elaborated upon in the global report with regard to ensuring fair and equitable access for medicines globally. The COVID-19 examples and other essential health technologies have been, used to provide the analysis from the perspective of the existing laws and global laws and licensing, the mechanisms for trade, and the solutions that could be also available for ensuring access at affordable prices, including the pooled procurement platforms, as well as the regional and national regulatory capacities to allow for easy access to medicines and commodities. The third element is given an important attention to supporting the workers on the pandemic front lines and all pandemic. But here it needs to be clarified that the frontline workers are not only health personnel. Very important. They are at the front line. They are the ones who are facing all kinds of effects of the epidemic, from the emotional to personal to economic, even threats to health, a very heightened risk of burnout, distress, illness, and death. And it is really important that there are mechanisms to support them and ensure that we have frontline workers that are able to face any other challenges, including continuing the efforts for HIV, responding to possible emerging threats, and also responding to the ongoing COVID-19 pandemic. And here, just to clarify, that the frontline workers, as I said, are not only health services, but also community workers that help in any way in providing the services and all kinds of services, from health-related prevention, treatment, vaccine, but also social protection, because then these components help resolve the challenges caused by inequalities and help protect some people who otherwise would have been left behind or even seriously affected by the existing pandemics, even threatening their lives. And then we have components that explain what is needed, what the support is, what kind of support is needed, starting by the political commitment and investment, value and support the community-led response and contributions of positive and community support groups, HIV-sensitive social protection, and addressing inequalities to protect the frontline workers in order to protect everyone and everywhere. The fourth component is human rights at the center of pandemic responses. And this is really important, because when you have populations who are most at risk being also criminalized and facing a combination of factors that further push them behind and that exacerbate and heighten the inequalities that they are facing, whether these inequalities are of economic nature, of social nature, of laws and policies nature, and also sometimes it's program design nature. But then all these components are really important to be considered. And the human rights aspects of it, laws and policies, are really important. We do see, for example, the evidence from Asia and the Pacific that all key populations and their behaviors are being criminalized in most countries. So with these kind of restrictions, criminalizations, denial of access to services that we see in many countries, it is evident the challenges that these populations would be facing and seeing in accessing the services. And it's an evident and direct link to the inability to achieve the global targets when populations who are most at risk are facing an additional challenge in accessing the services, which is imposed by the laws and the policies and the legal aspects determining the social life, but also the delivery of HIV response. And the fifth and last one is people-centered data systems that highlight inequalities, where it's really important to ensure that we have the ability to analyze the inequalities. Who is facing what type of inequality and who is more likely to be left behind? We have several aspects on how this can be reflected, and we see already some issues with regard to data availability, with regard to specific populations, or with specific subpopulations. If we look at the examples here, when it comes to key population size estimates, the gray area is the estimate that is based among countries who do not report data on size estimates for any of those populations. The black area is determined to be the estimated gap in methodologies or in the definition or in the counts that are being used for estimating the key population size estimates. And the blue-green color reflects the reported estimates. Now, when these populations are not counted and not included as targets in the programs with any differentiated approach for reaching them, whether visible or invisible, online or offline, high risk or low risk, that means those who are not counted will definitely not be reached and will remain vulnerable and at risk. And an example, we see that when we do the analysis for young key populations, and we see the high level in inequalities from within this group. So if we compare young sex workers, for example, 3 times lower than their older counterparts in ability to access HIV testing. These are data coming from specific countries, and unfortunately, it's not available everywhere for all populations. We need to strengthen this evidence, because when we know who are more likely to be left behind, with the more detailed specificity, we will be able to understand what kinds of inequalities they would be facing and what needs to be done, whether it is design of program or change of policies or adaptation of services and service delivery models to help achieve those targets. And this is a summary of what is in the Global AIDS report. It is a very interesting read, which I encourage everyone to access. It is available now on the UNAIDS website. It has been officially launched last night, our time. And you can see in this screen here, this is the front page of the report called Unequal, Unprepared, Under Threat, Why Bold Action Against Inequalities is Needed to End AIDS, Stop COVID-19, and Prepare for Future Pandemics. Thank you so much for your attention, and I'll hand over to Janelle for leading us for the rest of the session.
Thank you so much for giving us that high-level summary, but even so difficult to do in a short space of time. The richness of the report, touching on the key elements, really lovely the way you structured it according to these 5 elements for us to really dive into the issues. Thank you so much for sharing that with us, and we're going to take forward that reflection already, some of those highlights, into the panel segment, into the discussion we want to open up with our audience joining us in the virtual world. I'd like to acknowledge again our audience and participants joining us online through the Facebook live feed. You do have questions and opportunities and comments that you can direct to Tawfiq and any of our panelist speakers in this next segment. We won't pause now, but please do put your comments and questions into the feed. They will come to us and we will direct them to the speaker of your interest. At this point, let's transition to our panel segment. And as mentioned, we have 3 esteemed speakers who will be joining us in this segment. And I will introduce them as they come in to give their intervention with the questions that we have prepared for them. So first up, I would like to introduce our first presenter, our first speaker, who is Dr. Roland Sardan, who is Program Expert, National AIDS STI Prevention and Control Program, Disease Prevention and Control Bureau in the Philippines Department of Health. Good afternoon, Dr. Sardan. And if I can just ask you to up our conversation. Hello, and hello, I'm sure, to all of our participants. Thinking about the Philippines context, we'd love for you to share with us the ways in which the Philippines is protecting the gains made in the HIV response during the COVID-19 pandemic. Can you share a bit with us about the efforts of the Philippines in this regard?
Yes, of course. Thank you very much for the invitation. So, in behalf of the Department of Health Disease Prevention and Control Bureau, I would like to share to you the Philippine experience adapting the HIV response to the COVID-19 pandemic. So, the Philippine HIV scenario during the earlier stages of the COVID-19 pandemic, we have seen that there has been a significant decrease in the number of HIV tests performed, number of new diagnoses, and number of PLHIVs enrolled in ART has significantly decreased. There's also been noted sustained sexual risk behavior among our targeted populations, particularly men who have sex with men and our transgender women. And with this, we are estimating that we will be having higher PLHIV estimates by the coming years. So with the current situation, we have seen that because of the easing of the community restrictions and the various community quarantines, the situation of HIV in the country is slowly increasing and slowly improving. However, we have also seen that the treatment is slowly catching and viral load suppression remains high and testing coverage is now at 27. So we are now returning back into the pre-pandemic conditions. However, there's a strong need for us to protect these gains. So with this, we would like to present to you the output of the Department of Health Philippines, which is the NASP-CP HIV Adaptive Plan, which is goal to redefine the HIV response in the Philippines in the time of the COVID-19 pandemic. So this has been formalized through a department circular, which has been disseminated throughout the country for the guidance of our treatment facilities, our testing facilities, and the like. So the HIV adaptive plan includes several provisions as to the delivery of service delivery, prevention, testing, treatment, and cross-cutting measures that also includes advocacy, human resource and capacity building, and also about sustainability and financing. So this is a broad spectrum adaptive plan that will consider all aspects of the HIV program. So what are the examples of the activities and the various programs that has been implemented by the Department of Health together with our various development partners to address the or to protect the gains of the HIV program against COVID-19? So we have seen that the Department of Health together with our development partners facilitated the use of various methods to deliver ARVs to our clients or to our patients, particularly to the use of the striders. So this has been included in the HIV adaptive plan. So we have also facilitated the use of courier service and also door-to-door delivery of our essential ARV drugs and other commodities to our PLHIVs. So the Department of Health, also together with our development partners, we also advocated for the use of self-testing and also the provision of personal protective equipment among our frontliners and also our case managers and those who are handling PLHIVs in the community. So when the community restrictions has already eased, we also or the Department of Health, together with our development partners, also facilitated the conduct of continuous HIV testing as well. So, in continuation, because of the various community restrictions implemented in the Philippines during the COVID-19 pandemic, in the quarter 3 and quarter 4 of 2021, the Department of Health, again, together with our development partners, facilitated the use of various modalities such as the roving vans, for consultation, for treatment consultation, and also for vaccination. And one of the most popular that was used by the country is the use of telemedicine or telehealth, which was facilitated by our partners, our development partners, to facilitate the various consultation concerns of our PLHIVs in the country. So with this, I would like to end my slide. end my slide. And with this next slide, we have seen that 2 out of 10 PLHIVs have already been reported to be vaccinated with the COVID-19 vaccine in the country. So with this, I would like to end my slide. I would like to thank the UNAIDS for giving the Department of Health Philippines the chance to share the experience of the country to protect the gains of the HIV program against COVID-19. Thank you very much.
Thank you, Dr. Sardan. Thank you for sharing the Philippine experience in protecting the gains of the HIV/AIDS response in country. Before I transition to a second speaker, just one quick follow-on question, and if you can tell me in 1 minute or less, would you say that there are any aspects or lessons from the HIV response that you have put towards the COVID-19 response that has made a difference? If you can share in less than 1 minute.
Actually, let me just stop my sharing. Actually, the COVID-19 response has greatly shaped the HIV response in the Philippines. So, the National AIDS and STI Prevention and Control Program has really learned regarding the strengthening of our health systems, which was brought about by the COVID-19 pandemic. And the COVID-19 pandemic also has made us realize that the strengthening of the health systems, particularly in support for our HIVs, is very important.
Thank you, Dr. Sardan. So that really, in this context of colliding pandemics, as Tawfiq has mentioned, there are lessons that we can learn and apply towards pandemic preparedness. I'd like now to introduce our second speaker in our panel, who is Ms. Vanessa Monley, who is Program Officer at Youth Lead, the Asia Pacific Network of Young Key Population. So transitioning from a national context, the health context, to regional context, and youth-led community work. We're just lovely to have you, Vanessa. Let me ask you, please, how are young key populations in the AIDS response spearheading the responses to COVID-19 and HIV and tackling inequalities in Asia and the Pacific? How are they doing all of these things?
Great question. Thanks, Janelle. So young key populations and young people living with HIV already face inequalities in employment, social protection, accessing healthcare, and education, which have been made worse by the impacts of COVID-19. Since the beginning of the pandemic, Youth Lead has been working closely with network partners, stakeholders, and UN agencies alike, such as UNAIDS, to identify areas of additional support. In April 2020, Youth Lead conducted a situational analysis of the COVID-19 pandemic among its members to identify areas for support and intervention. In addition, the results from a previously conducted survey by the Interagency Task Team on young key populations, of which both Youth Lead and UNAIDS are a part of, on the impact of COVID-19, supported many of the claims and challenges experienced by young people across the region. So in response to this, Youth Lead reached out to existing donors to explore the possibility of fund reallocation for the YKP COVID Emergency Relief Fund. The Robert Carr Fund, one of Youth Lead's most prominent donors, agreed to the reallocation of program costs, and the first phase of the Emergency Relief Fund was launched in April 2020 with a total budget of $29,000. In August 20, after the first phase was completed, due to rising cases and poorly coordinated responses from governments, from which the World AIDS Day report points out, civil society organizations, and in particular youth-led organizations, had been unable to access resources and financial assistance. Thus, Phase 2 of the Relief Fund was launched and supported by RCF and AHF with a total of $23,000. The organizations we supported included Human Touch in India, Inti Muda in Indonesia, YK Nepal, Ya All in India, YPeer Philippines, Kana Cambodia, YSAB Sunro in Pakistan, Youth Lead Mongolia, VYCAT Vietnam, House of Chameleon in Fiji, and the Dove Foundation in India. This year, cases were not only rising, but many countries were seeing second and third waves with new variants. Therefore, Youth Lead, in collaboration with the RCF and UNAIDS Asia Pacific, contributed a total of $32,000 to 5 youth and YKP-led organizations in the Asia Pacific for the period of May to October 2021 to continue supporting COVID relief efforts. Thanks, Janelle. Over to you.
Thank you, Vanessa. I think you've not only said to us how young key populations are doing this work through Youth Lead, but also showcased already some successful examples. I don't know if you want to drill down into any one of those successful examples a bit more. Would you like to do that in the next, your post 1 minute segment?
Absolutely, I can do that. Thanks to the UNAIDS Asia Pacific contributions to the COVID-19 emergency relief funds, it has really maximized equitable and equal access to HIV services and solutions during COVID-19 through the leadership of youth and young key population-led organizations. Since we're quite short on time, I'm just going to go through how the funding has supported, amongst many initiatives, HIV prevention measures during the pandemic. Because so much focus was put on COVID-19, CSOs and YKP-led organizations felt that they had to fight even harder to keep their programs afloat. And even though, for example, Vietnam was completely locked down, VYCAP managed to produce HIV and SRHR, digital educational content for their YKP members, and distribute harm reduction materials to 15 provinces. And in addition, because of the emergency relief funding, it allowed for YPeer Philippines to continue their support for their work under the hashtag Get Condom PH program, where they distributed 11,520 condoms, were able to train 930 young people on HIV combination strategies, and screen 899 young people for HIV. And just to touch on some other strategies were essential care packages for young people living with HIV. And this included food, medicine, and cash support, also psychosocial support and socioeconomic support. And I just wanted to end, the goal to end AIDS by 2030 has been disastrously affected by the COVID-19 pandemic, as Taufik just mentioned. And in terms of it has been affected by the COVID-19 pandemic in terms of exacerbating inequalities for young key populations. And I just wanted to say, to get back on track, youth need to be at the forefront of the response. So several programs, including this one, really showcases the impact and necessity to fund youth-led HIV programs and initiatives. Thanks, Janelle.
Thanks, Vanessa. I know there was a lot of ground to cover in this short time, and thank you for reminding us of the strength and the power of community-led responses, of youth-led responses, and we can't address the biomedical without addressing all of the structural elements that Taufik Israel has already reminded us so strongly of. So to wrap up this panel segment, I now warmly invite our third and final presenter, who is Dr. Nitya Panupak Pungpapong, who is the Executive Director of the Institute of HIV Research and Innovation in Thailand. Hello, Dr. Nitya, welcome. Your question, or two questions for you today. Can you tell us how the Institute, IHRI, has scaled up innovation and community-led service delivery to respond to both HIV and COVID-19 in Thailand? Over to you.
Thank you very much, Janelle. And I first I have to say that I'm very impressed by what has been shared with us from the Philippines and from Youth Lead. And the very short answer to your question, Janelle, is that we use the people-centered approach. But the longer version is that I think very similar to many other countries in the region, innovations have been developed and implemented almost immediately in response to the COVID-19 crisis. And it is fortunate that in Thailand, we have had this key population-led health service or community-led health service being established and continuously strengthened, although mainly initially for HIV and sexual health over the past 5 years before the hit of the pandemic. And although we have seen like a huge reduction in HIV testing, STI testing, and PrEP and ART initiation and maintenance during the first and the smallest wave of COVID-19 last year, I think this year we have seen that we have a rapid bounce back of service uptake, and mainly this is through the community-led responses and telehealth, teleconsultation, self-sampling, ART and PrEP mailing system have been key innovations. And I have to emphasize that these responses have been conducted by community-led organizations on top of the COVID-19 work that these organizations, including IHRI, also have to be responsible for. So in terms of the community-led COVID-19 response. This is not HIV. This is COVID-19 response. I have 3 points to make here. And the first is that we don't question even for a second that community can be empowered to respond to COVID-19. And COVID-19 knowledge was quickly translated into a series of fact-based and practical community empowerment sessions, and communities immediately identified layer providers who would be assigned to work hand in hand with healthcare professionals who provided virtual COVID-19 care. That's first point. Second point, and the most challenging point, as always, is to get government and health professionals, those specialist doctors, buy-in. And it took us quite a few weeks to advocate and demonstrate our capacity and convince them to allow us to bring the first line COVID-19 drug to the community, out of the hospital to the community. And it took some time for the government to be brave enough to say that people can be cared for at home, to not be afraid to losing face, to admit that there were not enough hospital beds, and it was a mistake to order every case to be admitted to the hospital. And the last point is that we have seen this great leadership and great courage in the government, in our National Health Security Office, or NHSO, who is the payer of health services in the country, which in normal situation, this may be overshadowed by majority of people who are very conservative and want to do business as usual. And this is instrumental for the success of this community-led COVID-19 response, because with clear endorsement from the government, the community-led COVID response led by IHRI, together with other lead NGOs like Human Settlement Foundation, TNP Plus, Access, Swing, RSAT, and M Plus, and with great support from doctors from the Royal College of Family Physicians of Thailand, has brought COVID-19 test and treat and vaccination to more than 25,000 people in Bangkok, and now in the deep south and in the north of the country. And I think we are very familiar with universal precaution principle when we run HIV work. So it's our concept of working in the community to ensure that people can be cared for at home and without the need to use those overprotective equipment, which is very, very important, because stigma and discrimination shown by the use of that overprotective equipment can become immense, and we have to address that immediately, right away, to set a good example that community can live safely with COVID-19, and to ensure that country doesn't continue to use that fear-based measure to control the pandemic. Thank you. Over to you, Janelle.
Thank you, Dr. Nataya. In 1 minute now, in your follow-up question, if I may, because you told us about those that three-pronged approach around the COVID response, and you mentioned innovation, but thinking of the socioeconomic pressure on countries because of COVID-19, thinking of the increasing demands on the health sector, what are the strategies or thoughts around sustaining innovations in this context and creating that linkage with COVID-19 and HIV responses?
Yeah, that's a great question. And I think it is very crucial that we don't let the momentum of now the country or even the world recognizing the importance of community empowerment for community to take care of their own health, that just comes to an end because we are getting more used to the COVID-19 pandemic. So we need to make sure that the investment in community empowerment is also recognized and funded. That is an investment for something to happen. So we cannot ignore that. And I think it is also beyond money. It is about changing mindsets of the governments, of healthcare professionals. If we believe that the community-led healthcare and at least the primary healthcare will be the way to provide the best and sustainable healthcare for our people. So I think 2 things: money, funding, and the changing the mindset. Thank you, Chanel.
That's a great winning combination, money and mindset, the double M combination. Fantastic. Thank you, Dr. Nataya. Thank you to all of our fantastic panelists for your passion, for your technical expertise, for your experience sharing with us. At this point, I'd like to invite back to the floor with your cameras all of our great speakers today. We do have some comments and some questions. About 8 minutes, I think, we can give to this segment, and to take some of the questions coming from our audience joining us through Facebook Live. I'm going to start with a first question to Taufik. We have the question here: what evidence do we have about existing inequalities with regards to COVID-19 and HIV in Asia and the Pacific? Do we have existing evidence about inequalities pre-pandemic and how that might have worsened in this time? Over to you.
Very pertinent question, and thank you to those asking. We do have some evidence. We are lucky in this region to have an AIDS data hub who does excellent analysis, and it's not recent. It is known for years that it does advanced analysis on all the data that is available to us with regard to the HIV response. And that analysis, for example, the one I shared in the slide around young key populations, is not something that we have done just now in the context of the report. We have many more. But while I mentioned we have plenty of evidence on sub-key populations, age-wise, gender-wise, urban, rural, cities, and all these things, unfortunately, we cannot claim that we have the comprehensive evidence that we need to analyze and understand all kinds of inequalities: economic inequalities, social inequalities, behavioral, program design related, and these aspects. And this is why it is important to continue investing a little bit with that regard. What we do have the evidence, and I need to mention that, is that addressing those 5 elements in the report can help us achieve the last mile. We see how the community-led interventions have been extremely helpful in responding to COVID and help sustain the gains achieved so far, as well as advancing the performance in the HIV response. We have evidence in countries who are already in the last mile of epidemic control, and using those solutions, considering the inequalities lens, help them to further advance closer to achieving the 95, 95, 95, which are for globally and for the region set for 2030. We have countries who are achieving it right now in this year. So this is a concrete example as an evidence that tells us, yes, it is achievable. We just need to follow that frame, consider the comprehensive components, the comprehensive, and invest on them as needed. And that investment does not benefit only HIV response. It benefits the preparedness. It benefits preparedness for all kinds of epidemics and their response.
Thanks, Tawfiq. Thank you for reminding us of the evidence and that multiplier effect of the evidence towards pandemic preparedness as a whole. Our next question from the audience, I'm going to direct to Vanessa. Over to you. How do you think, if you do think, COVID-19 will impact HIV programming in the foreseeable future, especially for youth-led initiatives, given the shrinking civil society space and perceived competition for resources?
Well, I see in terms of, for example, the regional networks having a more holistic and intersectional approach to HIV programming due to the shrinking civil society space. And even before COVID, as you just rightfully said, we were facing a decrease of funds in the region, and the need to adapt and keep communities at the forefront is still imminent. We need to acknowledge that these days it's not just the fight against HIV, but climate change, migration, and now pandemics. So I don't think COVID is going anywhere soon, especially the most recent news about the Omicron variant. I do see programming for both HIV and pandemics working along more parallel to each other. And it just might be that we no longer have the YKP COVID emergency relief funding, but rather COVID components integrated into our programming. As the title of the World AIDS Day report reflects, we no longer can afford to be unequal, unprepared, and under threat. Back to you, Janelle.
Fantastic response. Thank you, Vanessa. My final 2 questions, or just transmitting from our fantastic, I will go to our 2 country representatives. I'll call first on Dr. Sardan for your question. You've mentioned some great examples around innovations and community-led service delivery. Are there any strategies or discussions already underway at the country level on how to scale up and expand as you move forward?
Currently, we are undergoing several consultations and also planning for various scale-up plans for our differentiated service deliveries. So we believe that by scaling up our differentiated service delivery capabilities, we'll be able to reach more of our PLHIVs, particularly during COVID-19 pandemic, because we cannot afford that the pandemic will stop us to achieve and be focused on achieving our 95, 95, 95 targets by 2030 or until this year. Thank you.
Thank you, Dr. Sardan. And my final question from the audience to Dr. Nitaya. You shared some great examples of these two country contexts. Are there any south to south programs in place for transfer of knowledge and experiences? Is that something that the Institute is thinking about? Over to you.
Yes, that's a great question. I mean, I'm always believe in the south to south technical sharing, and it's not only for HIV, it's not only for COVID-19, and I think it's for most of the health care services which may have these like mutual characteristics of being a chronic disease, being a highly stigmatized disease. So for the HIV component itself, we have been making these technical sharing sessions with many countries in the region already prior to the COVID-19 pandemic. And this is mainly for the key population-led health services, including how to empower the community who are empower people who are members of the key populations community to design their own service and to co-deliver their own services in which this can be applied for HIV testing, for ARDs. So I think that in the future, we certainly, all of us, will need to work in HIV and COVID in combination. It will not be any day in the future that we can say that, okay, now we shift back to work on HIV because we can end COVID-19. Yeah. Thank you.
Thank you so much, Dr. Nataya. Thank you again to all of our fantastic speakers, Tawfiq for giving us that overview and the key messages of the report and helping us to think about and seeing that in the context of this region and what are the things we need to be thinking about moving forward in this regard. And to our three fantastic panel speakers, sharing country context, regional context, perspectives of different types of communities and their roles and their power in driving change towards the positive outcome that we want in terms of responding to AIDS. Ladies and gentlemen, to all of our fantastic participants joining us through the Facebook live stream, thank you so much for your attention, for watching with us through the chat and sharing these questions, your comments even on the program. In closing, I'd just like to thank again all of you and to just remind us that progress against the pandemic was already off track, right? Tawfiq was already off track prior to COVID-19. And so many disruptions have come about as a result of the pandemic. But this report and all of the examples shared here in the launch event by the different speakers are showing us what is feasible, even in country contexts that have high rates of HIV infection, that we can make progress towards targets on AIDS. We can leverage lessons of the pandemic in managing the COVID-19 pandemic and future responses for pandemics or other crises of a health nature in general. And a key message, therefore, that I think we all want everyone to move forward with is that if we take on the inequalities that are just holding back the progress towards achieving our targets and goals in the AIDS response, if we take those inequalities on, really focus our resources, our attention on them and engage with the communities, we can deliver on this promise of ending AIDS by 2030. So with that message, a warm thanks to all of you again, and please do log on, read, share the report, share the messages of the report, and keep the discussions going. My thanks to all of you.
Thank you so much. Really good. Thank you.
Thank you.